All right, hello and welcome everybody to another episode of the Big Three on CPA TV. My name is Mihir Torsekar, and as always, I'm joined by my co-host and fellow economist, Andrew Rechenberg. And today we're going to talk to you all about the big three topics happening in trade this week. But before we get to the show itself, we wanted to give you the big 3 in 3. So, number one topic on the agenda today, Andrew testified before the Senate Special Committee on Aging, talking about bad medicine and closing loopholes that kill American patients. We're going to have Andrew, why don't you tell us a little bit about your experience yesterday? What are the big things you talked about?
Yeah, so for this topic, the first topic with the Senate Aging Committee, we had a great hearing recently with the Senate Special Aging Committee. Rick Scott was the leader there, and Kristen Gillibrand was the ranking member. And this is actually a very bipartisan issue that we all agreed on, that there's these clear issues that we can all get together and have these policy solutions to fix bad medicine here in the United States. And this bad medicine is primarily coming in the form of imports from overseas. And quite frankly, we just don't have enough FDA regulation to address these issues, not enough transparency, and not enough production here at home. And there's broad agreement on this issue, and I hope that we'll be able to get some change here. And that brings us to topic 2, which was also a discussion in the hearing, is biotechnology leadership. And we just released a big report here at CPA on the U.S. biotech sector and our competition with China. And unfortunately, China is rapidly catching up to us in this space. The NIH funding for the United States has been steadily declining in real terms, down 11% since the early 2000s, just because the funding's been pretty much flat and inflation's been ticking up. So we've had less and less research funding, and China's rapidly catching up. They've already surpassed the EU in research and development funding per percentage of GDP. And so this is a real critical space, and they've already surpassed us in clinical trials as well. And so we need a lot of investments in this area and to ensure that biotechnology is made and discovered here in the United States. And finally, that gets us to topic number 3, and we have a great update from Mihir on the U.S. manufacturing sector in September.
Yeah, so the ISM manufacturing report came out. There's some key findings from the September report that we wanted to share with you on today's podcast. It does show some signs of evidence of encouraging evidence for the manufacturing sector overall for the health. Production is up slightly from before. Employment shows a little bit of an improvement as well. Supplier deliveries and inventories and input prices are also moving in the right direction. So we'll talk about that in today's podcast. So let's get to it. All right, so let's hop into the big 3 topics for this episode. So first topic on the agenda, Andrew, on October 8th, Wednesday, you went before the Senate Special Committee on Aging, and you presented your testimony on bad medicine and closing loopholes that kill American patients. And in particular, you laid out 5 strategic pillars that are concomitant with your recommendations. And I was wondering if you could talk us through what recommendations you offered the committee, and maybe just we can hear a little bit about your experience testifying. So go ahead.
So the 5 pillars that I offered to fix bad medicine in the U.S. is primarily focused on the main problem, and it's that right now we only have a 37% domestic market share for manufacturing pharmaceuticals. And so that means we get most of our generic pharmaceuticals from imports. And this is really where the main problem lies. So my 5-pillar plan addresses exactly this. So pillar number 1 is the tariff rate quota system, which creates a space in the market via set quotas and high tariffs for high-risk countries to create a space in the market for U.S. producers. Number 2 is production and investment tax incentives to help jumpstart U.S. production via the PILLS Act. Pillar 3 is FDA reforms to ensure that anything that we are importing comes in safely. And so the main problem here is that the FDA has 90% of the FDA foreign inspections are pre-announced, and many plants go 5 years or more without any reviews. And so we have no oversight for these overseas plants. And then when they are imported into the U.S., we just rely on company paperwork, not independent batch testing. So the main solutions here is to have independent batch testing in U.S. labs for any imports to ensure that we test the quality before they actually get to U.S. patients, not having to recall drugs after patients have already taken them. And then we also make sure that these foreign facilities are as safe as they can be. But in general, in the long term, we still want to reshore here in the US. And that's another critical point for Pillar 4, especially for the defense supply chain. And it's directing federal procurement, especially from the VA and the Department of Defense, to start buying American-made drugs. And this is directly aligned with Senator Warren's bill on the Pharmaceutical Supply Chain Defense and Enhancement Act, which aims to do exactly this. And finally, we get to Pillar 4, which is the biotechnology leadership. And it's really just directing that we need to have much, much higher NIH and biotech startup innovation funding so that we can actually discover and make the cures of tomorrow here in the US. But I think a general feeling from the entire hearing is that this is really a bipartisan issue now. We had a great showing from both sides of the aisle, both Democrats and Republicans, and they're both taking this issue very, very seriously. And by and large, we agree on a lot of the solutions, especially what we can do right up front for having more transparency for country of origin labeling, for having better FDA controls by making our medicine safer over time. And everyone also really agrees with bringing production back to the US. There might be some very slight disagreements, but in general, everyone agrees with this. We had guests from different pharmaceutical manufacturing companies, from API manufacturing companies, from the Brookings Institute, and all of us witnesses agree that we need to reshore more here in the US, especially for our essential medicines. And so I think that this is going to be a really great opportunity to have some bipartisan support and bring things back to the US.
Yeah, one of the things I found I was really struck by with you being present at that event yesterday was the fact that we have a lot of credibility at CPA on bipartisan issues. We're not just I think it just underscored the bipartisan nature of our approach and how we are issue driven about trying to reindustrialize critical supply chains, and that's where it is. They could be a Democrat introducing a bill that we can find good ideas in, and you leverage that in your testimony, and I thought that's probably a reason why it was well received. That, in addition to the fact that there was a complete absence of the fireworks that are so typical that tend to characterize these kind of hearings, really spoke a lot to the kind of traction that these ideas that you were able to present yesterday so well, by the way. It really attests to the kind of traction we have in Washington right now. So well done yesterday. Congratulations. So second, keeping with some of the research that you've been doing, I think this week, if I'm not mistaken, you had published an article, or a report, I should say, on the new biotech Cold War, and how U.S. medicine can't afford to fall behind China. Why don't you talk us through what some of your key findings were?
So this is a direct expansion from that Pillar 5 that I just talked about earlier for this biotechnology leadership that we need here in the U.S. And what the report outlines is how China is rapidly catching up and even surpassing the U.S. in a lot of key biotech areas in the U.S. And so one major example is China has now surpassed the U.S. in clinical trials, in total number of clinical trials that are taking place in China. And they've already surpassed the European Union in research and development as a percentage of GDP. And they're rapidly catching up to the United States as well. And so China has made this a very, very high priority for their industry to follow the low stakes, well, not low stakes, but the low cost generic manufacturing, and follow that up with the advanced biotechnology research side. And so this is what we see in a lot of different industries, that the technology and the research and development follows manufacturing. And so just as essential as it is for us to reshore generic pharmaceutical manufacturing, we're also losing this edge in biotechnology. And one of the other main reasons for this is that FDA funding is actually down in real terms, 11% since the early 2000s. This is because funding has essentially remained flat while inflation's continued to go up. And so labs are going to have to cut more and more as costs get higher and their funding doesn't increase. And so we really need to have key investments here on the research side of biotechnology and make sure that we have the edge here. And there's also a lot of problems with the clinical trials coming from China, that they're tested on ethnically homogenous Han Chinese populations that doesn't represent the US patient base. And so even though they do have these advantages in the number of trials, it doesn't mean we can trust their research. And so this is just as much of a vulnerability for losing this leadership as it is from relying on Chinese medicine that's not up to the same standard as our own.
Yeah, that was another great bit of research that you did, and really kind of carried the momentum forward that your testimony was able to build up, or to build off of as well. So Great week for you. So a third item we wanted to talk about today was the Institute for Supply Management recently just put out their latest scorecard. Every month they put out a scorecard to kind of gauge the general health of the U.S. manufacturing sector. So a couple of headline numbers wanted to share with you and give you a little bit of an idea of what the punchline is as far as what we at CPA, how we interpret the findings. So one of the main indicators was, a measure above 50 indicates manufacturing supply or expansion, and a number below 50 means contraction. So in September, the ISM number came back at just under 50 at about 49.1. But that actually shows an improvement from where we were a year ago, before the tariffs were imposed, before Trump had taken office. So that actually tells us that manufacturing it still has a little bit of runway to go, but there's improving conditions in the horizon. So that's one key notable takeaway from the findings. Also, production looks like it's moving in the right direction. It's moving back into growth. Hiring looks like it's stabilizing, and prices for materials are cooling from some of the earlier highs that we witnessed. So in general, when you take all of the metrics that I've just kind of run down, I think from CPA's perspective, it's fair to say that factories are adapting to the higher sort of costs that tariffs, that they're incurring from tariffs, but they're not passing that on to the consumers, right? So all of the prognostications, the fear mongering about what tariffs would do, how it just immediately, redound to the consumers has not materialized, which is of no surprise to us at CPA. But I think that it sort of tells us a little bit of a larger story that industrial policy, some of the reshoring efforts that we're finding are not fueling inflation. And we've been talking about this for a long time here at CPA. And in fact, we could argue that they're beginning to strengthen the base. So I think time was going to, we just need a little bit more time for these policies to lay out. But I think there's some encouraging signs here. I don't know if you had any concluding thoughts to offer on that as well, but I'll turn it over to you real quick.
Yeah, and on top of that data, I think that I wanted to highlight there was a recent Philadelphia Federal Reserve study that surveyed manufacturers in the U.S. and found that 40% of manufacturers are reporting an increased manufacturing activity. And this is up 30%. This is up from 30% the month before, so it's a 10% increase month to month. And on top of that, only 17% are reporting declines. And so we're seeing a clear trend here of this pickup in manufacturing activity as tariffs are increasing. And so I think it's also it's a good caution that manufacturing does take time to scale up. You're not going to have a new factory built overnight, but we are seeing these starting signs that manufacturing is coming back with tariffs and it's not raising these prices. And we're seeing that in studies like the one you mentioned or the survey by the Philadelphia Fed. And so this is a clear direction that we're going, but also just cautioning that this does take time. But the history is very clear that these tariffs, with the steel tariffs, the aluminum tariffs, washing machines, you look at any of these industries over a few years, it does increase production. And I think we're starting to see the signs of that.
Yeah, great. I mean, this was a fantastic week for CPA. I mean, we've been so busy, but we're really proud of the work we're doing. And this week just kind of exemplified just the fruits of our labor, and we're moving in the right direction. So it was great to see all the work that we did this week. So that's all we have for the show this week. Join us next time for another episode of the Big Three on CPA TV. Of course, and we'll be talking about the next Big Three items of the week. So we'll see you then. Thank you.